Now, if you have ever had doubts about laboratory test results you obtained, your doubts may be well grounded if you didn't obtain them from an ISO certified facility. It turns out, of the over 2,000 medical laboratories operating in the country, less than 5 of them are internationally certified. Nearly 4 years after Ghana adopted the ISO 15189 code, the Ghana Standards Authority is deciding to go after laboratories that do not have the certification. Director General Professor Alex Dodo revealed this at an ongoing Celebrate Lab West Africa conference in Accra, from where Manuel Cranting reports.
International Organization of Standardization is an international standard-setting body which facilitates the safe, reliable and high-quality creation of products and services. Among other things, the ISO standard number 15189 provides specific requirements for quality and competence particular to clinical laboratories. In 2017, Ghana adopted a regulation which meant that all labs operating in the country needed to be accredited. The Ghana Standards Authority and other regulatory agencies have since been working to get labs in the country certified. Professor Alex Dodo is Director General of the Ghana Standards Authority.
Prior to COVID, the Ghana Health Service has been seriously concerned and interested. In fact, in 2017, so that means prior to 2017, the Ghana Health Service, the Standards Authority, together with support from the US CDC, decided that Ghana has not adopted the international standard for medical laboratory practice. It is called the ISO, which is International Organization for Standardization, standard number 15189. But in 2017, Ghana adopted it. Now, once you adopt it, that means that this is the first time, or this is when you have it.
But after close to 4 years since adoption of the ISO standard number 15189, less than 10 of the over 2,000 labs in the country have been accredited.
Now, how many of our labs are using it? Currently, very few labs have been accredited to that level, which means that, yes, they are in the process, but they haven't reached there. And as the medical laboratory scientists themselves have said, practice is variable. Until you have them all accredited, you are going to get, shall we say, different results from different labs. Some are very high, some are very low, and that is not satisfactory. Since every health worker, that's the doctor, will make his or her decision on the lab results, the lab results should be consistent. Because if you get it wrong, then everything is spoiled.
Professor Alex Dodo, who reviewed this at the ongoing Celebrate Lab West Africa conference in Accra, said the GSA will begin cracking the whip on defaulting laboratories.
So far, our inability to have done that over the years, to the extent that Ghana at 64, very few laboratories have been accredited to international ISO 15189 requirements, means that there is a gap, and that gap must be filled. And fortunately, if we do it, we'll create jobs. So we are just telling the country that we would enforce, and if it means going to court, we will go to court to enforce. But we are doing that because consumers have paid taxes for us to do a job to keep them safe. If we fail to do that, the consumers will hold us liable, and we have no choice but to serve those who pay us, and that's the consumer, the taxpayer.
On his part, immediate past president of the Ghana Association of Medical Laboratory Scientists, Dr. Ignatius Awinibono, charged the regulatory agencies to fast-track the approval of local innovations to be able to harness the expertise in the country.
Initially, some of the sensitivity and specificity requirements were not met, but as we talk, the kits now are hitting close to 99% and 80-something% sensitivity. We pray that they expedite action, especially for an entrepreneur within the country who has been able to invest huge amounts of money to be able to come out with such a kit. He should be encouraged, and his work should be facilitated for testing within the population, because we need the antigen test to be able to augment whatever is happening.
Well, let's get some clarification on this from the regulators. Dr. Philip Bano is Registrar of the Health Facilities Regulatory Authority, and we also have Professor Alex Dodo, who is the Director General of the Ghana Standards Authority. Thank you very much, both of you, for making time to speak with us. Now, and I want to start with you, Professor Alex Dodo. Why is the ISO certification so crucial?
The ISO certification is important because whenever you have anything which is certified to a standard, there is consistency, there is reliability. You can trust the quality because it's specified, it's written down, and everybody knows what that system does. So if someone says, I have a laboratory, it is ISO certified, accredited, you know that its management and its equipment would all follow certain routine. I mean, it is what it is. You have to follow it or else you lose your accreditation.
All right. Now, does that mean that the results that a lab that is not ISO accredited will release is not, kosher?
No, you cannot say that. We have several laboratories in Ghana,
all right,
which have been going through a lot of capacity building and give results, which we all trust. The difficulty, though, is that it is performing today very well based on the requirements you have. Will it perform the same tomorrow? Will there be consistency long term? Should there be no supervision every day? Will the system still give the same results? And normally the answer will be no, unless you have the accreditation. So if you look at Ghana, a lot of the public health laboratories went through a lot of capacity building to be able to deliver. But prior to 2018, we did not have the ISO certification, as in Ghana had not adopted the ISO standard. So in 2017, the Ghana Health Service, GSA, together with the US CDC, adopted the International Standards Organization Standard number 15189, which is the standards for medical laboratory practice. Having adopted it word for word, what the next steps are is that all medical laboratories will seek that accreditation so that both their management and their practices can follow a pattern that is consistent, whether in the public sector or the private sector. Unfortunately, if you don't do that, there's inconsistency and quality, or rather quality issues will arise if they are not already present.
All right. Now, I want to come to you, Professor Dr. Philip Bano of HEFRA. Now, why is I want to understand why is HEFRA certification alone not enough for these medical laboratories, and the need for us to also have the ISO standardization? Hello, Dr. Bano, if you could just unmute for us, and I'd want to repeat the question. Why is HEFRA certification alone not enough for these medical laboratories? Right, we're having some challenges with Dr. Bano. So I'd want to come back to you, Professor Alex Soto. You indicate that less than 10 of the over 2,000 medical laboratories actually have this ISO certification. Can you be a bit more specific when you say less than 10?
Okay, so to get accreditation, you normally will go to either an accreditation body, or sometimes you go to a certification body like the Ghana Standards Authority. We do know that there are laboratories in Ghana who have obtained their accreditation from other bodies, and there are several of them, as in the bodies giving the accreditation. So we were being very factual in that, for instance, I think it's either MedLab, MDS Lancet, or one of them have gotten accreditation, ISO 15189, that they have boldly displayed on their signage.
Essentially, so you're talking about two.
From GSA.
So you're saying two of them have certificate?
I was saying those that I have come across, but if we do an audit, we may see up to 5, maybe up to 10, but definitely no more than 10. If you're asking that as Ghana Standards Authority accredited any laboratories or certified them to a management system, the answer is that we have not given any such certification. We have given training to the laboratory professionals. We have told them that when we are done, we need an accreditation body. Ghana as a country is just about starting its accreditation service for laboratories, the Ghana National Accreditation Service, which is not fully functional yet. But we hope that by the time we've trained all the laboratories, they'll be ready for accreditation. But in the absence of a Ghana National Accreditation Service, we can buy accreditation services as we do already from SGS or other companies, both in Ghana and overseas.
All right, and finally, I want to ask you, let's take the COVID-19 test that we have running as an example. I want to ask you, Professor Alex Dodo, you have to choose between an ISO certified lab and one that doesn't have the certification to go for a test. Which one would you go?
Can I answer this in a long way, like one? Would I accept all COVID tests undertaken in Ghana that have been approved by the FDA, HEFRA, and the rest? My answer will be 100% yes, because I know the processes. It included validating the equipment, checking that any scale there has been calibrated by GSA, making sure that the reagents have been approved by FDA, and then HEFRA finally wrote to us to finalize the approval of those laboratories. However, if someone is coming from overseas with a COVID test result, between accredited and non-accredited, I will any day go only for the accredited labs from overseas.
All right. Now, let me go try Dr. Bano again. Dr. Bano, so we've been having this conversation about these labs, and the Ghana Standards Authority is saying it's going after the labs that don't have the ISO standardization. What will be your role, or the role of HEFRA in all of this?
Thank you for your question, and I'm sorry about I couldn't connect earlier. Having some challenges here. Yes. Just to add to the ISO and why it is important and why HEFRA licensing alone, though adequate for national but not for international purposes. For example, when you obtain the ISO, the 15189, it allows you to obtain the best advice based on best practices elsewhere. What is the best sample to use for a particular test? So whether it's a nasopharyngeal swab or oral swab or saliva, or what is the best sample to use? So based on international standards, they can better guide you. Second is that you can also interact with their clinical staff and give further training and further advice, so that whatever others are doing, they can share that knowledge with others. Also providing better opinions for diagnosis and patient care. So that can also be given and shared. So all of these are part of why getting international international standardization is important for all our labs. I hope that's clear.
All right, but this process, the process of getting the ISO certification, doesn't come cheap, does it? Because it would involve you implementing some systems and putting some systems in place to ensure that you get that certification. Isn't that a challenge with many of the medical laboratories we're having in the country? I'd want to ask Dr. Bano first.
Yes, cost is always an issue, and I'm quite sure that is why since 2017, some of our labs have not been able to implement this goal. But it's nonetheless a goal that we must try to achieve, because it will improve overall patient care and the quality of care that we offer in the nation. As a regulator, I'm not happy to know that just a handful of the labs are able to apply or adhere to the international standards. So we need to do better, but we need to encourage them and support them, and also find the resources for the labs and how to obtain this very important standard that we must have in order to improve patient and quality of care in the nation.
Now, Professor Alex Dodo, are you still going ahead to clamp down on those without the certification, even though cost, as we have discussed, is an issue?
Let me sort of kindly let your viewers know a few things. So today at ALISA, there is a conference ongoing called Celebrate Labs, being hosted by the Medical Laboratory Scientists Association across West Africa. Now, the leadership of the labs are saying that for consistency, for reliability, for all sorts of things, they wish to have ISO 15189 accreditation, so that their practices are consistent and their service delivery will be world-class. What the Standards Authority said is that we have gone stage 1 to adopt an international standard, which we are making available to them at a slightly lower cost. What the next bit is that accreditation costs money, but it's all about quality and quality of care and quality delivery. Now, the good news for us is that our laboratory associations are desperate and desirous of being world-class. The next argument should be, how do we help them do it? Because, let's put it this way, none of us is going to fly a plane if we are told that, well, there is an international standard, but we'll stick to only the national one. We believe that quality is ultimate. And whether it's a service in Ghana or Nigeria or anywhere else, when it comes to laboratory services, when it comes to care of people, our aspiration is for the best. Now, we know that accreditation is tedious because it involves paperwork. Every single process must be documented. But that is the right thing. That is the right thing which ensures that should you have any issue with your treatment, with the lab results, you can go back and know what went wrong, if anything, and seek redress. What we hope as a Standards Authority is that we will partner with HEFRA and with all the other groups to figure out a way of engaging the young people who need jobs to support us in writing the operating procedures and so on and so forth, so that our laboratories who have expressed a passionate desire to be ISO 15189 accredited will get accreditation, starting with a few which are already close to getting it this year and prayerfully many more next year.
All right. Thank you very much. Professor Alex Dodu is the Director General of the Ghana Standards Authority, and Dr. Philip Bano is the Registrar of the Health Facilities Regulatory Authority.